JQ Radio, Southwest Florida, Sarasota, Bradenton. Today, we have a great guest on our panels, Dave Ochendorf, specialist, over 10 years practice on Siesta Key physical therapy. We're talking about all the different subject about physical therapy, pain, knee, shoulder. Very, very interesting subject for athlete, walker, cyclist. So, Dave, you mentioned it before that there's injections such as gel, stem cell, and the third one will be cortisone. When do you come to decide this person need gel, this person need cortisone, or this person needs stem cell?
Yeah, that's a great question. The patient has this discussion with their orthopedic surgeon, and the orthopedic surgeons and their physician's assistants are skilled at applying these and administering these injections. And often, I would say the surgeon will offer to the patient a cortisone injection into the joint, and the joint is an enclosed capsule. So that substance that they inject into the knee joint or the shoulder joint, for example, is somewhat contained in there to allow that substance, the medicine, or whatever it might be, to kind of linger in that area and to work. So I would say often they'll offer the patient a cortisone injection first, or physical therapy, or a combination of both. Let's give you an injection and send you to physical therapy. And then in physical therapy, we can work with them on some exercises and activity modification and the right amount of rest and guiding them back into their activity. Now, in cases where maybe the cortisone didn't work, or maybe the doctor doesn't want to give too many cortisone injections, too many cortisone injections in a short amount of time can degenerate the joint and the tissue because it's such a powerful medication. And so a lot of them don't like to give more than one every 3 months or every 6 months, or in some cases even once a year. So in that situation, they may suggest that you try like a visco supplement type of injection where it's a substance that may help lubricate and cushion the joint, and for some people that gives them great relief for a while and buys them more time, either in therapy or with rest, or more time until they need a joint replacement. And so it's typically the orthopedic surgeon determining what exactly the patient is a candidate for and what different factors there are related to, their medical condition, and if there's any side effects to cortisone that could affect any of, comorbidities or any other medical conditions they have going on, and determining what exactly they're a candidate for. That's usually a decision made by the surgeon and the patient, and we typically see them after that.
So it's fair to say that cortisone is like a temporary remedy for a pain at the knee or shoulder or hip, right?
Yeah, so this is a great discussion to have because we get this question a lot. But isn't it temporary? Isn't it just going to wear off and then I'm going to need another one? Well, for some of these chronic inflammatory conditions that have been really lingering in the shoulder or the knee, when you add cortisone to the area, it can be temporary, but in a lot of cases, we see it really get people over the hump. It's a nice adjunct to to physical therapy and to rest, and their pain in a lot of cases does not come back, and so it helps just give them the extra boost to get over the injury completely. And so it's not always temporary. It often is a part of the treatment for long-term success. Now, I wanted to elaborate on this earlier when we were talking about posture and different biomechanical faults and imbalances, muscle imbalances that we see. If we can get the pain and the inflammation settled down with the cortisone, and we can address some of those imbalances, we can strengthen the areas that are weak, and we can improve the flexibility in the areas that are tight, and we can teach people about correcting some of their biomechanical problems, whether it's related to their job or their sport or everyday life, and come up with ways to modify their activity. Now we're taking a much more comprehensive approach, and we have a much better chance for long-term success than if they just had the cortisone injection by itself and did nothing else. Does that make sense?
Right. That makes sense. You touch a very good subject about the stem cell, and that's the word who's going around a lot lately, or stem cell. Let's just define this word stem cell for the radio listener. What is the stem cell? Because a lot of people relate this to killing babies or unborn babies. So let's try to clarify what the stem cell stand for out there.
Yeah, and the science behind this is I'll go into it, and I'll just say that there are different sources for stem cells, and this is more of the area for a surgeon or an orthopedic surgeon or a doctor who does this type of therapy to weigh in on.
Right.
But I can give you a basic description of where stem cells could come from. And often they'll take a needle and they'll harvest some blood from the middle of a bone, like your bone marrow, and then they have a way to spin that down and really try to isolate the stem cells from bone marrow. And that is a common source. And then another common source would be taking blood from an umbilical cord. So that's where I think when the source is an umbilical cord, that's where I think some of the controversy comes from. But that is a little bit out of my area in terms of, how that's, what type of donor is supplying that from the umbilical cord, and is there any harm to anybody or to any human beings? That I don't know the details of how those sources or where those sources come from. I just think that it makes people nervous that maybe it could evolve into something more than that down the road. But that, again, is a little bit out of my area. But typically, those are the sources of stem cells that you hear about. Now, they could be taken from, other sources less commonly in the blood, fat tissue or something. But those are the ones you hear about the most, being harvested from the bone or being harvested from the umbilical cord. And if people have concerns, I've had patients that have said they insisted that their doctor only take it from the bone marrow. But again, that's a conversation to have with the doctor, and more research can be done on the source on the stem cells that way.
So my basic explanation, and you're taking a bone marrow and you're injecting that into the knee who need cartilage or who need a rehabilitation?
Correct. So now we go into the, what stem cells are used for. And And again, and the doctors who do it are better sources. What I hear from, orthopedic surgeons that I speak to throughout the year, and these are, highly accomplished, incredible, very successful and experienced surgeons who describe what they're using stem cells for. And these surgeons are, constantly reviewing the literature and the science, and they're basing their practices on, evidence-based medicine and what's in the research. And when I say research, we're looking at, credible, peer-reviewed medical journals where there's double-blind, well-controlled studies with large volumes of subjects, and analyzing that type of research and saying, are stem cells effective for A, B, or C conditions? And
right.
They also have large numbers of patients in their practice that they're using some of these treatments on and deciding if they're effective or not. So
right.
What we're hearing is for some tendonitis problems, tendinopathy problems, where it's a chronic inflammatory situation or a situation that's really not healing or really stagnant, if you will, and it needs kind of a boost and it needs a kickstart to the healing process, that those seem to be responding well to stem cells. We've even heard some of the surgeons who are repairing rotator cuffs or replacing joints say that when they add stem cells, they notice that the patients are recovering a little bit quicker and having less pain. And so that's a way that they're using it. Right. Mostly these orthopedic surgeons are telling us that they're not seeing good results with correcting advanced arthritis. Now, that's not to say that if somebody is really trying to avoid a joint replacement and really wants to make sure they've tried everything, then, that is an option they're giving them. Well, you've tried cortisone, you've tried some of these other substances that we've injected. We can try stem cells. And, I've seen some arthritic knees where maybe there was a defect where like a piece of cartilage was chipped off, and there's been stem cells applied, and the person followed a strict protocol where they rested for a certain amount of time and then started back into a very gradual, very conservative and gentle exercise program that's developed by surgeons and physical therapists, and in the end have long-term success, with the combination of the stem cell, the rest, and the physical therapy to correct some of those imbalances and postural problems that we're talking about. Then they did well. And it's hard to know how much of that was the stem cells, but again, when you take a comprehensive approach like that, I think you give the stem cells the best chance to work. If you inject stem cells into a joint and you still have terrible posture and terrible imbalances, and you're still overworking the joint with your everyday activity, there's probably less of a chance, right, that the stem cells are going to be effective.
Right. So the reason the recovery I'm asking this question is, you see at NBA, at Major League, even high-level soccer, this person got injured, or NFL, then a week or two later be back with strength and better